Hi, I'm Jamie Camelia, and I'm here today with John Miller. Hi, John. Could you talk about your background a little bit?
Certainly. Um, my background is very varied. Uh, I'm a registered nurse. I've been a registered nurse for over 25 years. Um, I was a private investigator that did insurance fraud for years. I worked as a manager in the insurance industry in a variety of carriers for years. And for nearly 20 years, I worked as a senior level executive in medical utilization management. So a very varied background.
Yes, but all relating to different aspects of the medical field, so you have a varied knowledge.
Absolutely. I'm fortunate enough to really, even from the very beginning, really have always been involved in the arena of trying to help people, whether it would be understanding and investigating to ensure that what people say they have, or working in utilization management to ensure that they get the treatment that they need, or of course working as a nurse. I still even today work at times in a high acuity intensive care unit just so that I can stay on top of current trends and medical conditions.
That's great. Can you explain to our audience the role of a patient advocate, which is what you do now? What services do you provide, and why would a patient engage your professional services?
Certainly. The role of a patient advocate really is to help individuals navigate really this complex maze that is our healthcare industry. With everything, especially that's going on in today's healthcare arena, it's really hard to understand the ever-changing insurance carriers, the ever-changing policies, the summary of plan descriptions, which is when you get your policy, you have to understand what's covered and what's not covered. Understanding the motivations of, when you're talking to the insurance carrier, or your coverages, and making sure that you're, what do you get and what don't you get. Really navigating yourself through the entire system, whether it's from the treatment that you need, or the bills that you have to pay, or the care that's being received either for yourself or for a loved one that might be in a facility. Whether it's going to the doctor's office and making sure that you're making the most out of that appointment by having the right questions and getting the right answers or understanding the answers. There's needs for research. People don't understand what to expect when they get a large diagnosis. There's needs for monitoring to make sure that the people are being treated with dignity and respect. There's wellness training. Just making sure that people, it sounds like a simple concept, but making sure that people just really do look after themselves, making sure that they are going to their appointments and understanding what's going on in their life. And we also do trainings and advocacy trainings to help people also help themselves as much as possible. So that's, I think, the role of an advocate, I think, is to really incorporate all of those things in the best interest of the individual patient.
It can be an overwhelming process.
Yeah.
In your opinion, why have patient advocates become necessary in our healthcare system?
I think, again, because of the ever-changing environment in our healthcare system and people not knowing what's coming. I think first to answer that question, I'd like to reference really a study that was done at Johns Hopkins. And that study came across and said that the third leading cause of death in the United States was from medical errors. And that study basically went on to say that this really came from a discoordination of care, fragmented insurance carriers and coverages, the switching back and forth, meaning the switching back and forth, employers changing carriers trying to get the best price, which means now you're changing your in-network and out-of-network doctors, which means that now the doctors who knew you don't know you anymore. So if you can imagine, if that's the third leading cause of death, this fragmented system, healthcare system that's going on, and the challenges of the doctors getting new patients constantly, having limited periods of time to be able to work with them and work with patients. You can imagine how much comorbidities go on. And what I mean by that is if people are dying and that's the third leading cause of death, can you just imagine how many errors are going on? So that's what we really see. I mean, you see a lot of things that can go on, mistakes that happen, mistakes that people don't even realize was a mistake. And I'm not talking about a mistake where a doctor comes along and makes some type of medical error. This isn't about that. I think most doctors overwhelmingly care about their patients and want to do the best thing for them. It's really the fragmented systems that go on and the unrealistic expectations and reimbursement timeframes that they have to work under that really cause so many of these errors. People can go on and think that the care that they're getting is good, but in all honesty, it's because they don't know. They don't know what they don't know. And I think that what we're seeing is really the ability to help people understand really what their options are and help them get through that.
So when would a person engage the services of a patient advocate?
I think that's a very large segment, I guess, of areas why somebody would engage a patient advocate. Certainly in situations where they have a large medical bill and they really are not sure as to what they owe and what they don't owe. Certainly in cases of a seriously newly diagnosed condition of some nature where it's going to potentially affect their lives as they move forward. Cases where they have a loved one, maybe they're a distance from that loved one. So maybe mom is living in South Jersey and the son is living out in California. And they're not really understanding what's going on with mom. So they're really, they're getting conflicting stories. They're really not sure that they're getting the whole thing. They want to make sure that mom's okay, but there's really no one here that can help them. So a patient advocate can really come in and help that individual, by, again, working with them to ask the right questions with the doctor, communicate, make sure that the care that they're getting is meeting the needs that they really have. It can also provide reassurance to the loved ones that are distant and can't be there for them that someone is really just interested in their care, really just interested in them. As independent patient advocates, which we are, we believe our only allegiance really is to the particular patient. We are paid individually by the patient, so then our allegiance really is only for that particular individual. So you don't have to worry about, everybody has good intentions, but they're also bound by their employers and who they work for. So, somebody might be telling you something, but, overall that might be coming from the same insurance carrier that's sending you the bill. It could be coming from the same doctor's office that's treating you. And not that there's any kind of collusion or bad thing that's going on, but understand that, that person has to have the interest of their employer in mind. So we believe that when you have a non-biased opinion, someone that's there just for you, that you're going to get the best information, the most unbiased information. And that's what we strive as patient advocates, many patient advocates strive to do. The term patient advocate can be out there, and there are different segments and different people do it in different ways. Some are independent, some do work for different facilities. Our opinion is that when it's non-biased and you have no allegiance to anybody else, that is really the safety net, that someone can know that they're getting the care and the treatment and the information from someone who's only interested in their best interest.
Is there a national certification organization in order to find a reliable and trained patient advocate?
Well, there's no certification as of yet. There is the certification for patient advocacy. There is actually a board that has been formed, and they are working on doing an official patient advocacy board certification. both myself and my partner Jeannie were fortunate enough to be asked to author some questions that may be used in the board certification. So they're at that stage now where they're trying to really get to the test question stage. So they went through a lot of stages, and they're kind of at that stage right now. I think secondarily, the second part of the question really was, is there an organization out there where people can go and to look for patient advocates? And there is the Alliance of Professional Health Advocates, and really that organization is out there, can be a reference point to look for patient advocates in individual areas that might be able to help in a variety of patient advocacy services. So that is a source, both Gina and myself are members of that. So that is one source that can be used for individuals if they're looking.
Great. Why do you feel doctors and hospitals too often forget that patients have rights and that patients should be treated as customers of the healthcare system rather than a number on a chart?
That's an interesting question. I don't personally believe that doctors forget that patients have rights. I think that innately, my belief is that they are focused so often on the medicine. So they're really looking at the diagnosis, they're looking at the treatment, they're trying to figure out the drug reactions, they're really trying to figure out the medicine that's needed. And I think what ends up happening is often the holistic piece gets lost. And that's really one of the reasons why patient advocates are needed, because what's happening is the doctor is focusing on the medicine, but the treatment of an individual is typically more than just the medicine that's going to go on. So, and the medicine that's going to be used also has to relate to that patient's religion, their culture, their individual needs and circumstances. So what a patient advocate can do in this circumstance is really help to make sure that the patient's being treated holistically, that all their needs are being met, in addition to making sure that the right medicine is being met. But I think a lot of times the question that you're asking is, are they forgetting about it? I think that their focus becomes the medicine. I think that, sometimes with help and a clear picture by a patient advocate can help that doctor make sure that what they're doing is the medicine is now coincides with the need of that particular patient in a holistic care.
Does your background as a registered nurse give you a different and unique perspective as a patient advocate?
I think so. I think, both myself and my business partner, we're very lucky to be experienced nurses for too long to talk about, as well as having insurance industry background, utilization management background. I think it does make I think it can make a huge difference for a patient, especially when working within the healthcare arena, helping someone interpret what their doctor is saying, making sure that the questions that are being asked from individual specialists, I think it does give a huge advantage, so that we can really make sure that the visits with the doctors are really the time is maximized, so that we can go back and forth. Because a lot of times, I think an individual patient walks out of the room and they're like, "Well, so what did they say?" Or somebody will ask them, "What did they say?" And they're sort of like, "Well, he told me I needed this, but why?" And they're like, I don't know, he told me." So I think what ends up happening, and the advantage that we have, is that we can talk to them, we can help really explain to them a little bit more detail of why the doctor was saying what they were saying. And we can also get clarity when clarity is needed. If a doctor says something that maybe isn't what we're used to hearing or understanding, we can ask it in a fashion, I think, that can get the proper answer more quickly, because we can really get to the medical terminology probably quicker, especially understanding the specialties that are going on. Now, you should understand that patient advocacy, the field itself, you certainly don't need to be a nurse. I mean, the concept of being an advocate for the patient a lot of times is a great benefit, and patients can benefit from someone in their corner fighting for them. So I don't want to say that every patient advocate needs to be a nurse. That's absolutely not true. I can say that the ones that are probably have an added spectrum advantage, but you have to look at the individual patient advocate that you're searching for and whether what they have to offer answers your individual needs. Because it's not always about medical. It could be about insurance. You know, we're lucky to have the insurance background, so we understand that. But people that don't have to have a medical background but have an insurance background, sometimes it's just caring and understanding, being through certain things. People that work with the elderly and nursing homes and those type of things. So I think it's making sure that you find your advocate, the one that you find that's the best suited to help you in your individual circumstance, and that's really what I think patient advocacy is all about.
What do you think happened to the bedside manner for doctors and patients? There are longer waiting times now, shorter visits, and it's difficult to get a definitive diagnosis.
Yeah, I think that, certainly what I've seen and what I see, I think so much depends on really how busy the doctor is. Now, in today's marketplace, doctors are very busy. The insurance carriers have strict rules as to how much time you can spend in all the coding, which has now been upgraded to the 10 codes, the ICD-10 codes, and it's very challenging from a time standpoint. Where I think a while back it wasn't as time sensitive. So I guess what I see a lot of is, if your doctor happens to be ahead of schedule and you're in the office visit or you're in the hospital and there's nothing, going on that's really more pressing, they'll spend the time with you. Because again, I really believe that the majority of doctors really care and want to answer everybody's questions and do the best that they can do. But sometimes time just doesn't allow that. So when they're busy, a lot of people that need more time really don't get the time they need. And that's a shame. And again, obviously I'm a big believer in patient advocacy, and I believe that that's really where the patient advocate can come in, because you can streamline. You can make sure that when that doctor only has 3 or 4 minutes, that you can at least get to the primary criteria of what you need to know. Because again, you've been working with that particular patient. You know what their needs are and what they're looking for, so you can hone right in on the specific questions that really need to be answered in order to get to the next level. So, I think it's a symptom of the healthcare marketplace. And the sad part is that in today's marketplace, because of employers constantly changing from a financial standpoint, different healthcare carriers. So now you're in network and your out of network changes. So these doctors don't even know you. So if anything, they need more time with you, and unfortunately they end up getting less because of all the criteria that's put on them. Again, that's why I believe this niche of patient advocacy really is important to help people. And I think people don't understand really how much help they need. I think a lot of people still think that it's their doctor has, he's giving them, and they're trying to give them everything. It's not, we're not in there trying to say, oh, the doctor's doing something bad. We don't believe that even remotely. But what ends up happening is we work in conjunction with doctors to make their lives easier and make the patient's life better by making sure that they understand what's going on and making sure that they communicate and are communicated with the information that they need.
In your opinion, what should be the ideal patient experience when visiting a doctor, hospital, or other provider?
Yeah, I think each experience should be a little bit different. So I think when you go into a provider's office, I think the first thing that, the first thing, again, we talked about earlier, which is just from a customer service perspective, I don't believe you should wait any more than 15 minutes. And I'm not talking 15 minutes from when I walk in the door till they take me back to a room where I sit for another half an hour. I'm saying when you get in there, have the courtesy, I think, for each individual, and things happen, but 15 minutes, I think, is a reasonable time frame. And what I don't see offices do a lot of, which they could do, is I would welcome a phone call that says, hey, we're running behind. You know what I mean? Either I can reschedule you or you can come in and a half hour late. At least it shows respect. So I think a lot of what patient advocacy is making sure that the patient is really receiving the respect that they have for their time as well. And I think we talked earlier about how important that is for the patient experience. Well, I think that's just one, I won't say minor thing, but certainly in the scope of everything else. I know it's not at the top of the list, but it's something that should be considered. So I think a short wait time. I think when you get in there, you want to make sure that the doctor and a provider's office is really looking at your history and understanding, why you're there, and understanding how your comorbidities or your health diagnosis and history that you currently have relate to why you're there. So that they're not just for the first time, like hearing you, haven't seen you for 6 months. They kind of have an idea. Now, I'm not talking about an hour and a half study of your history, but a good idea of what's going on. So I think once they have that, I think then it takes either if you're looking to me to say what the perfect thing is really then listen to the patient. Why are they there? What's going on? What are the needs of that particular patient, and understanding that, and then going through and doing what they're there for, which is their medical evaluation and their recommendations for treatment. I think the ideal situation in that is, again, I use this scenario a lot, and we really haven't talked about it, and maybe we'll talk about it later, is different perspectives. So if you're in there getting, if you go to a medical doctor, you go to a surgeon, obviously the medical doctor wants to treat you medically. The surgical doctor, normally their primary thing is surgery. So they're not always going to be in sync. So I say that to say that when you're in the physician's office and they're telling you what they think should be there, they should give you all your options, not just the option that they feel would be the best option. Because really, it shouldn't be up to them. It really should be up to the patient to make the decision, understanding all of the facts. Now, you're obviously there for their medical opinion. I'm not suggesting anything else, but people are intelligent enough to know that if there are other options out there, let me make that decision that might be best for me. So part of that perfect experience is understanding, I'd like to know what all my options are. I may 99% of the time go with what you recommend, but there may be something that you don't know that changes my mind if I knew that option existed. So from there, I think understanding my preferences as a patient and addressing those preferences, and then allowing me to make that decision. So that's my ideal doctor's visit. My ideal hospital visit is you go to the hospital, I want to be triaged correctly. I want to be triaged quickly. I want the diagnostics. So when you go in there, one of the big things that, of course, that goes on is you go in there and they have to triage you. They triage you and try to determine how sick you are, basically. So from that scenario, then you want to go over to what are the diagnostic tests that they need to do. So you want to have those things happen quickly, whether it be an MRI or a CAT scan, whatever is appropriate for why you're there. My background, I see a lot of strokes and neurosurgery and heart conditions and kidney conditions and all those type of things. But the bottom line is when you go into the hospital, you want to be diagnosed quickly and you want to have those tests as quickly as possible. Now there, as a patient, you want good coordination of care, because in a hospital, you're going to have a lot of specialists that are going to see you. And everybody has their own specialty. And this, again, is why I will, I'm very passionate about the fact that many times you do need a patient advocate. Every one of these specialists are very smart, very good at what they do, and they care. But it's that coordination of my specialty is diabetes, I'm an endocrinologist, or my specialty is neurosurgery, or my specialty is nephrology. Well, the focus, rightfully so, is on that particular physician and that particular physician's ideology of what I want to cure in that segment of health. But many times there's not somebody there that's really looking at that overall picture, that's coordinating and making sure that the endocrinologist and the neurosurgeon and the pulmonologist and the nutritionist and all those are working together and they're all in agreement. So I think what patient advocacy does is really force everybody to make sure that all those considerations are working in conjunction with one another. So to me, when they're all working together, then you're getting the best patient experience that you can have in a hospital. From other type of facilities, I think if you're going to a nursing home or you're going into a skilled nursing facility, well, a lot of that, especially in a nursing home and a skilled nursing facility, you really want to make sure that the care you're getting, and in a hospital, of course, but probably more so in the others, is you want to make sure that you're getting, the patient is getting really respect and their dignity is being protected. And a lot of times it is challenging, but there are simple things that can be done. And sometimes when the care is being given, people don't even recognize they're really not being respectful of the person's dignity. I'm not saying people do anything on purpose. I'm just saying that sometimes they don't recognize it as readily. And I think when you have an advocate that's in there that can work with people to say, please close the curtains when, you know, they have to clean up my mother, you know what I mean, type of scenario, or, it doesn't look like, we haven't even really even talked about some of the other services that really go on, and they're there because, infections, or the treatment that's going on, or what's being done to them, is it being done clean? Not everybody knows what's clean. I mean, it's hard enough to get people to wash their hands. So I think there's a lot of things that can be done. So the perfect environment, or the perfect visit when you're in a nursing home, I think, is really making sure that everybody is showing respect and dignity, making sure that the needs and the care are being done on a regular basis for that particular individual. And really that their needs are being met, and that's a very general term, but and involves an awful lot. And patient advocates can really help you understand what all those different factors are.
Thank you, John, for talking with me. I'm Jamie Cornelia for the Power of the Patient Project.